The Children and Adolescent Center the thought process started 5 years plus ago. The building had been talked about as something that we needed in northeastern Wisconsin. Why do we make these families drive? They already have enough stress on their plate. They have enough things that they're trying to go through with a medically complex child. The last thing you need to do is have this windshield time that people talk about. There was no one-stop shop in northeastern Wisconsin where you could get everything from primary care to comprehensive care to mental health under one roof.
And I think it was really looking at what is needed. What do you as a patient need, and how can we surround what you need with things that will help you to get through?
It's the amount of planning and time this team took to hear all the different voices in our community of what do we need? What do we need for our kids in this community when it comes to healthcare? And clinicians were asked their setup preferences and what would be ideal for them. And nonprofit partners like Sybil Hop were asked, what do you wish this building had? This really came from our partnership through Connected for Kids. And through that partnership with both Theta and Children's Wisconsin, this concept of having this facility, not only where Children's Wisconsin can bring in their specialists, but also where Amplify Health by Bellin can also kind of put their flag in the ground that we also deliver top-notch, world-class pediatric care here too.
But then our Bellin region took it one step further, and we included the mental health component. So how do we include mental health is no longer this other piece that's over here. Put mental health right in the dead center with primary care, keep mental health there. How do you do PT, OT, speech? How do you see adolescent medicine in comprehensive care and literally under one roof? Once we got the approval to officially go through and do the project, right? Then comes the herding of cats that happen, because now you are herding everything from ENT, asthma and allergy, audiology, prepare, pediatrics, adolescent med, add in Children's Wisconsin, a whole nother complexities. Anybody pretty much in the organization at some point probably touched this project.
It's all about putting the patient and their family first. And that was a non-negotiable in all of the work that we did and everything that we looked at, from colors on the floor to colors on the wall to textures to the seats that we picked out for people to, what devices do we have available for them? How do we help them through the stressful things? What kind of fidgets do we have?
We did things in the building that were different and unique, and it tested the waters. The bubble wall, right? The bubble wall was not an easy task to get that approved, because infection prevention wanted to know, how are you going to keep it clean? Is it going to have any germs that are going to be transmitted? How are you going to do this? The artwork in there is probably one of my most favorite things to look at, right? We pushed the buck a little bit further and we said, no, we actually want kids to design their artwork and put their artwork into the CAC and let them see it. We sent it out to our communities and said the word community. It's all we told the kids. Draw me whatever you think community means to you. So these kiddos got to submit artwork that was on an 8x11 piece of paper. And then we blew it up, and they are now 3x5 feet that are on every wall.
If you have been in this building, they have not only little kid toilets, but little kid sinks. And anyone who is a parent who has had to go in a public restroom with their kids and you're pinching their little waist up on the sinks while you wash their hands, it was just that bathroom I point out on every tour, and it's like a highlight for people.
When they walk in the door, they start to have that sense of, I belong here. That, any anxiety that they had, it kind of gets pushed aside, and they start to build that trust because it's obvious that we know them and that we're here to help them. And that's happening even before they meet the care team and before we start the care with them.
Now maybe that one parent doesn't have to worry about FMLA because they don't have to drive to Madison, they don't have to drive to Milwaukee. They can get the care right here in northeastern Wisconsin. So for me to know that maybe, just maybe, that we've touched one child and one parent a week, that's all the satisfaction I need.
The thing that's been the most rewarding is watching the faces light up as people walk in. And it's fun to watch not just the patients themselves, but to also watch their families. But I also love watching our care team walk through and be happy and proud of the space that they're working in. Makes it easier to come to work every day and deal with some of the challenges that we have to deal with in that space as well.
I'm incredibly proud of this organization for investing the way we did. You know, it's just it's a tribute to how we feel about the smallest people in our community to invest like that. I think right now those moments are happening that this team is going to hear about in 10 years, about some lab draw that was less scary, or a conversation that could happen because you had it out on a playground instead of sitting in a typical office, or the child life program, you know, those moments that happen to little kids that they don't understand. They don't understand what is either happening either to their family or to them. And these miracle workers that we call child life specialists come in and explain it to them in terms that they can imagine. I mean, those things are all because of what this team made happen, that they made this facility and the spaces within it. And I think what they have to be most proud of is yet to come.